myself, I'm one of the health services managers in the surgical program in Fraser Health. One of my departments is the National Surgical Quality Improvement Program. All of our teamwork and all of our initiatives are all geared so that you have a great surgical experience. I'm glad that you've chosen Fraser Health for your care, and we look forward to taking care of you and as we work towards better outcomes for all of our patients in British Columbia. Thank you.
Hi, my name is Suzanne, and I'm one of 2 quality improvement consultants for Fraser Health NSQIP. I have what is possibly the best job at Fraser Health. I work with frontline staff on action teams to help them meet their goals. I also work with their managers to ensure that frontline staff have the time, the tools, and the resources they need to succeed. In addition, I work with surgical clinical reviewers from NSQIP, Fraser Health, to ensure that the data they collect and analyze is well used by the teams. It's a winning combination, so we have clinical expertise from the frontline nurses, QI expertise, and data expertise, and the result is improved patient outcomes and engaged staff.
My name is Darina. I'm the clinical nurse educator at the orthopedic unit at Surrey Memorial Hospital, and I'm part of the UNI Preventing UTIs action team. A urinary tract infection is an infection of the urinary system which includes the bladder and kidneys. It is the most common infection which occurs in a hospital, and the majority of them are catheter related. A catheter is a thin tube which is placed into your bladder to drain urine. The urine is drained into a drainage bag, and germs can travel up this tube into the bladder to cause an infection.
Hi, I'm Brenda Smith. I'm the patient care coordinator for surgical admissions, and I'm part of UNI Preventing UTIs action team. Now, there may be reasons that you do have a catheter after surgery, and it could be part of this is your surgical procedure and the catheter's in because they're looking at how much urine are you putting out, and they're monitoring that on a very regular basis. The other reason could be is that you're not able to pass your urine, and then they would put a tube in and drain the bladder and then remove the tube after that. But for either of these, please ask your nurse so that you're very clear in your head. There's a time for the catheter to be in and there's a time for the catheter to come out.
Hi, my name's Elena. I'm an RN on surgical, and I'm also a member of the UNI Preventing UTI team. One of the things that I'm here to talk to you guys about is what can put you at a greater risk of developing UTIs. Some of these factors are having your catheter in for a longer period of time. Women are typically more susceptible than men to developing them. As well, if you have diabetes or are older in age, you're more at risk to develop a UTI. I'm going to talk to you guys a bit about the signs and symptoms that are associated with having a UTI. These include or may include fever. You may feel the need to urinate more often or not enough. You may have a burning sensation when you urinate or may have some pain to your lower abdomen. As well, you might experience like cloudy urine or might notice a foul smell to your urine.
Always clean your hands before and after doing catheter care and clean around the area regularly. Wash your hands with soap and water for at least 30 seconds. Always keep the drainage bag below the level of your bladder when walking and above the ground but below your waist while lying in bed. Use the clips on the beds to hold your drainage bag. Ensure that your catheter tube is secured with a stat lock to prevent it from moving. Do not pull or tug on the tubing and ensure that there are no kinks or twists. Increase the time you spend walking around, as this could help reduce the time the catheter stays in.
So my number one tip for you guys is to be an advocate for yourself and make sure that you're asking your nurse why you had a catheter and when your catheter can come out, because it'll just help prevent you from getting a UTI if we can get it out sooner.
I'm Pavin. I work as a surgical clinical reviewer at Surrey Memorial Hospital. Each NISCOP site has an experienced nurse who undergoes rigorous training with the NISCOP program to work as a surgical clinical reviewer. Our role includes collecting and submitting high-quality data to the NSQIP database, analyze the data to identify opportunities for clinical quality improvement at our specific hospital sites. The changes in data trends show us the improvement as we work towards our goals of reducing post-operative complications for our surgical patients.
John Wong, I'm the general surgeon at Beasarch Hospital. Several patients after their surgery will have a urinary catheter draining their bladder, particularly if they've had surgery that affects their bladder function. It is important afterwards that patients take a role in their care in preventing urinary tract infections so they can be up and about walking as soon as they possibly can. And then they need to be reminding their nurse and their doctor that catheter has to come out as quickly as possible because it is a tract for bacteria to enter the bladder and to cause urinary tract infections. Together you and I can